For over 35 years, I was in active addiction. During that time, as a result of the traumas and things I experienced in active use, developed mental health issues, unbeknownst to me. I got to a point in life I continued to get caught in a revolving cycle of treatment centers, incarceration. I've been to prison 6 times. Spent a total of 11 and a half years of my life in the North Carolina prison system. But I've also highly educated. I did well in school. I've been to 5 universities, dean's list on all of them. But for some reason, I kept going back to prison. Even those periods when I wasn't using substances, I still went back to what I was doing and ended up back in prison. The last time in prison, something just hit me, said, something's not right with the way I think. And it was at that point I decided to seek help or find some help, ask for help for something other than just the substance use. And when I was able to address the mental health issues, also, my thinking got back right, and I was able to recover. And today, I have a variety of jobs. We don't have time to name all of them. I own a company called Answer. Answer stands for New Start While Empowering Recovery, which describes me and what I'm doing with my life. And that's enabled me to now, just like today, to be here to try to give back to others and share the hope. And so I've just now become executive director and founder of a nonprofit called Share Hope Incorporated.
I am a substance use counselor in Charlotte, North Carolina for a nonprofit called Anuvia Prevention and Recovery. And I'm also working with opening Charlotte's first recovery high school, Emerald School of Excellence. That's also a nonprofit. And a little bit about me, I struggled with substance use and mental health at a young age. Yes, in and out of doctor's offices, and got to the point where, I have 5 years in recovery today. And the thing is I want to be in a place where I can help others and show everyone that there is a message of hope, and that there's no stigma around this anymore. Like, the stigma is that no one gets well. Like, this is just an endless process. But in reality, we're all here to prove that it's not, and that recovery is possible. So that's why I'm here today.
I work for Alliance Health. That's the managed care organization that covers 5 counties: Wake, Durham, Cumberland, Johnston counties. But I work for the TCLI program. We connect people who deal with severe mental illness, connect them with supportive housing in the community. It's based on the Olmsted settlement, 2012. What brings me here is because I'm a big advocate for mental health, just dealing with it all my life. I dealt with depression. I also deal with ADHD. My mother deals with depression, so just watching the things that she's dealt with and the lack of support that came, I guess you say, from the community and from family, and just seeing the lack of support that individuals get today. I really think if we become more inclusive and begin to embrace people, that'll bring about that recovery that we desire for many. That's what helped me recover, as well. Community people came around me to love me, to educate me, to help guide me in the direction I need to go. So I'm here to help others in the same light.
My mental health symptoms started when I was 5 years old. These worsened ages 14 through 16 when I experienced some traumas, which led to severe suicidal urges, which led to being hospitalized twice. During my second hospitalization, I got my hope back, and I went on to graduate high school along with my associate's degree at the same time. I then got my CNA, and now I'm working on becoming a peer support specialist because I believe it's my calling to give others hope.
I'm an educator, teaching 11 years here in Charlotte. Originally from New York, but moved here in 2008 to teach. And I struggled with mental health when I was in high school. So it was my junior year. I struggled with an eating disorder and depression and self-harm. It was a really tough junior and senior year, but what was amazing was our community, our school community embraced me and gave me alternatives to graduate on time. And when I saw that there are options for folks when you're struggling, and it was very hush-hush, but I still was provided with some support. And being an educator and seeing the struggles that our youth are dealing with, and it's escalating and there's minimal resources, and we just need to do a better job, but we have hurdles. But I do believe when we're together fighting this, like you see right today, that we will be breaking through some incredible ground that maybe hasn't been. And I'm here because I want to also, just like everybody else, share what it means to kind of let your pain turn into some passion and purpose and truly drive you to do great things. And been an educator, and now I'm the founder of a nonprofit to start the first recovery high school for teens struggling with substance use. And it's just incredible to see the people, though, that do help you, because it's an ongoing battle and process. But to know now that I have people like on my speed dial that I know I can call that years ago I didn't, we're truly doing great things together.
I am a wife, a mother, and have worked in many roles in healthcare through the years. And my bottom line experience is that the capacity of humans to heal emotionally and live, maybe even live with some symptoms, but live much more meaningfully than what often happens in our system, is why I stay in this and why I stay hopeful. And I'm especially hopeful because of all these younger folks around here that are united to see mental health recovery. It's got to become the expectation in our system. It's not. But it's got to become no, it's not. So that's why I'm here, and I appreciate the opportunity to be here.
I started experiencing mental health issues when I was very young. And I always say that drugs and alcohol saved my life, because if I hadn't had them, I would have killed myself. I know that. So I used them very effectively for a long time. In 1991, I got sober. And a lot of things got better, but my mental health issues didn't. It wasn't until about 12 years ago I went to a training and met some people that were talking about mental health recovery, that it was possible and that it was probable. And I got on fire. Mm-hmm. I love what I do. I love talking about recovery. I love watching people walk through the process. I have experienced hospitalizations. I have studied at some of the finest institutions in North Carolina, including UNCC and Cedar Springs. So I have fun with my recovery. I have to. It's got to be fun. It's got to be purposeful. And I am so grateful to be a peer support specialist. I have a master's in social work. 30 years in the field of human services, and I'm just very excited every day to be talking about recovery.
I'm 27. I graduated with my associates in registered nursing in 2016, and mental health has been a part of my life since I hit puberty at the age of 13, which ended up leading to a suicide attempt my sophomore year of high school. I live in a rural area, part of North Carolina, so access to care was something that prohibited me from being in recovery, and it really took until I went to nursing school myself, and I connected with different resources and different places in my community that gave me hope to continue through nursing school. And then once I graduated, I've worked for DHHS and other hospitals, and now I'm doing transport care. But to me, being open and talking about my mental health is the biggest source of success for my recovery. And like, I want people, not only people, but like my patients and everybody that has struggled when they were younger, to see that as an adult, you can still struggle when you're younger. And if they have support and the right resources, they can be successful and they can achieve their dream.
I was 13 when I received my first of about 7 mental health diagnoses. And like so many people that get labels of mental illness, I was also given what we call a prophecy of doom. And that sounded like you're sick and this is your diagnosis and you're always going to be sick. And along with that came, you won't be able to go to college, you won't be able to have a home, you'll be in and out of hospitals for the rest of your life. And I believed it for a long time. It took me about 7 years to get out of that illness identity and that illness cycle, and several bouts with suicidal thoughts and attempts, and just really, really struggled. And I found my recovery from mental health issues actually outside of the system and outside of services. It wasn't until I rebelled against that illness identity that I was able to say, you know what? This isn't working for me. It's actually making me sicker and sicker. And so I actually did graduate from Syracuse University with a degree in psychology and decided I was going to go into the profession. I wanted to learn about what helps and what harms people like me, people that experience emotional distress. And so my first job was in an inpatient unit, and I was just stunned. I was really shocked at how we perpetuate myths around illness and this recognition that those of us that experience extreme emotional states actually can get better. It wasn't present. It was very much an illness paradigm. And the more I got into the field professionally, the more I became exposed to that illness paradigm. So by the time I moved down to North Carolina, it was about 2004, I looked around and I didn't see other people that were labeled with mental illness, that were out in the open, that were talking about it, that were kind of righting the wrongs and really challenging the myths, that were challenging the services and the systems that kept people like me sick. And so I did something that was considered really bold, and I started a nonprofit here in Charlotte called Promise Resource Network that is operated completely by and for people with mental health diagnoses, as well as co-occurring substance use, experiences with homelessness, incarceration, and a whole bunch of other social challenges, because I really wanted to change the perception and the focus from illness to wellness. We work with people who are uninsured. We work with about 1,000 people each month here in our own community, and we remain completely operated by people in recovery, and that is our message. We also were just given a federal grant to start a statewide organization run by people with mental health issues. It's the first time in our history of North Carolina that this federal grant has been given to somebody in North Carolina, and it really is going to be a statewide effort to shift policy and shift practice, shift the language and the understanding of what actually helps people to recover.
I have a nonprofit as well that's dedicated to mental wellness for teen girls, women, and their families. I'm a veteran of the U.S. Air Force. I'm also a mother of 3, and I'm a woman diagnosed with bipolar disorder, bipolar 1. And my journey began about 26 years ago. When I was just 13 years old, I was diagnosed with depression, followed by later diagnoses of bipolar disorder and anxiety. And I've been on this journey for a long time, and we didn't really talk about it in my family. We didn't talk about it in my community. We didn't talk about it in the Air Force. So for a long time, I suffered in silence. And it wasn't until I began to have real conversation that I began to heal. And once I began to heal, I feel like it was my duty or my responsibility to help not only myself heal, but my family as well as the community. So mental health is my passion, it's my purpose. Unfortunately, it has been my pain for a very long time, but I've turned my pain into my power, and my power lies in real conversation about mental illness and mental health. And now I'm a certified peer support specialist, so I do help others who are in recovery, and I tell my story wherever I go, and I feel like each time I tell my story, I'm healing a little bit more, and the next person is as well.
I was labeled as being dyslexic when I was younger, and overcoming that took a long time, even up till college times, really struggling with that. But also in college, I was labeled as being bipolar disordered. 1 with schizophrenia. They didn't really know my diagnosis for a while. They kept on moving back from schizophrenia to bipolar to this to that, and really couldn't figure that out for a while. I've been in recovery since 2006. From disorder, really hasn't really affected me in a really long time, and really wanted to become a peer support specialist to get people on track with their lives.
My journey started when I was very, very young, I think probably at 2 years old, and I remember things that I don't think a child should remember. So people said, what came first, mental health or addiction? And Sharon mentioned something, I love the way she says it, is that drugs and alcohol saved my life. And they gave me a platform to realize another side of myself. And so I have been clean since 1994. And then, just like she said, and many have said, then I realized the issue was still there. It didn't go away. It didn't go away through the normal channels, and I kept it hidden because I was in theology. I was in a theology school, and I'm now an ordained New Thought minister. And what that means is that you teach the law of cause and effect. And it's a metaphysical teaching, and the arena that I was in is that you focus on what you want, not what you don't want. And I'm like, okay, great, but you don't talk about your problems. So I went from one area of being in hiding to another. And I was in hiding all those years until when I had my center, people would come up to me and they say, you know, your story sounds interesting. Have you ever dealt with anyone who has depression? And I'm like, absolutely. And they say, well, can we get over that? And I'm like, absolutely. And I didn't know at that point the languaging of recovery around mental health. And I have struggled, and then I realized that I didn't have to struggle anymore. The organization, Promise Resource Network, literally changed my life and saved my life. After all these years in recovery and being in hiding about who I am, and that, you know, the label doesn't really matter, as that every day is an opportunity for me to redirect my thinking. And what I have found is being a teacher and being a peer support specialist has given me a life opportunity that I never thought was possible in ministry. And so my ministry has now become sharing my story and sharing hope, sharing love and compassion and understanding, and living a life that is representative of what recovery can and does look like.